The Centers for Disease Control says the number of kindergartners being vaccinated is dropping, and the number of exemptions is at an all-time high. Only 92% of kindergarten-age students received their required shots last year.
Now, before COVID, that number, 92%, was at 95%, and the decline appears to be continuing. Now, some parents say vaccinations pose a health risk, but doctors say the decline could trigger a rash of deadly diseases once thought to be in the past. The Mayonis family consists of parents Chris and Elizabeth and 3 healthy, active children, ages 5, 7, and 9, all up to date on their recommended vaccinations. Like many parents, they balance the challenges of raising children with the advice they get from doctors and information they see online.
It worries me when I see something, particularly about a child who may have had an adverse reaction to a vaccine. But what I try to tell myself is I need to see what Johns Hopkins says about this. I need to see what Mayo Clinic says about this.
Elizabeth got the recommended vaccines as a child. Her parents heeded the warnings of diseases from polio to measles to tetanus and beyond. Vaccinations had eradicated deadly diseases, and there were very few concerns. Today's world is different.
Behavioral issues, autism disorders, right? All of this we have questions about.
Their family pediatrician is Dr. Alan Kaufman of Highland Pediatric in Chattanooga. Their stance on vaccinations is very clear.
We encourage families, they need to make that decision on their own. But if that's a decision that you feel strongly about, feel good about as a family to not vaccinate, then as a practice, we can't participate in your pediatric care.
But not every parent is sold on every vaccination.
We would leave that physician's office then. The physician that my daughters go to, they do not make us get vaccines. They suggest them.
Dr. Kaufman blames much of the vaccination denial on disinformation spread online and in-person gatherings.
When you're trying to protect the herd, you want to make sure that the highest level of protection is in that community. What we see is a lot of times folks that do not vaccinate tend to congregate together in homeschool groups or a Sunday school group or within other kind of social gatherings where people have more leanings to that.
Among today's young parents, few have seen what their great-grandparents witnessed. A rash of childhood deaths in the 1940s, 50s, and 60s left an indelible mark in their lives, leaving no hesitation about the vaccines that wiped out many deadly illnesses.
We need to be very careful that we don't create a situation here in the United States where we're worried about those illnesses.
Many families now face at least one autoimmune disorder, from rashes to food allergies to sinus infections and more. What's behind this? Is it the food we eat, or is it vaccines? These are questions doctors face each day.
It's been nice to see families want to have conversations. I would encourage families to talk to their pediatrician or their family practice doctor about these issues. That's a great place to get information.
When some parents hear doubts about vaccines, they believe rejecting vaccinations is one thing they can control. Some don't consider themselves anti-vaxxers. They just don't want to take the risk of unknown vaccines.
I do like to research things myself before making a decision. I do that on a lot more stuff now as I get older. So I do like to do the research first.
But Dr. Kaufman, while understanding their concerns, pleads with them to consider the source of information they receive about the risk of vaccines.
I would also tell parents that they're comfortable with that level of risk all the time. The odds that you're going to be in a significant car wreck is about 1 in 350. And so we're comfortable getting in a car and driving to McDonald's. We say the benefit of doing that is better than the risk. And I would say that the risk of the benefit of preventing these diseases is well worth that small risk.
The CDC is especially concerned about the resurgence of measles. They say to establish herd immunity to protect communities, vaccination rates in children need to be at least 97%. But at 90% and headed lower, there's increased risk for many children and adults.